With immediate effect, only urgent and emergency medical procedures will be done at the Queen Elizabeth Hospital. This was the directive given to the Barbados Association of Medical Practitioners today from the board of the hospital.
We can't treat you if we don't have sutures, if we don't have the proper equipment, if we don't have these gloves, if we don't have linen, if we don't have blood gases, if you don't have CT scan to make sure you diagnose you properly. We can't treat you if the ICU can't ventilate you properly. So it's not us telling you anything. We're just saying that this is what's happening, and we're very concerned, and we want the government to restore the levels so we can move on and treat our patients how we want to treat them.
Are you going to seek an urgent meeting with John Boyce?
We're always open to meeting with the minister. We have an open door policy.
Help us to understand, though, what is the true picture. You've mentioned the lack of sutures, blood gases, and the like. But for, as an old editor used to tell me, Miss Brathwaite down in Barbados that would be listening to this or reading this in her paper, what does this mean for her? Dr. Chapman.
The shortages are critical. We cannot provide the standard of care that is required of the institution. That is what it means. So when somebody comes in and has a problem, whether they come to accident, emergency, whether they come to the operating theatre, we do not have the resources to give them the standard of care they deserve as Barbadian citizens.
In other words, if you get a cut, you have to stitch it with a suture, there are no sutures. So we have to use the sutures for people who have urgent situations. So we can't do elective surgeries, take off your little lipoma, do a hernia, these are all simple things. Because if you do that, when you come, the child comes with the appendix, you must treat them properly. When someone comes with a stroke, we won't be able to do the imaging to treat them properly. This is what it means.
And Dr. Williams, you're A&E, so I think yours is most critical because I mean, as is, A&E is the department that people will be coming, accidents and so on. What's your situation?
Our situation is that we still have the capacity to deal with our life-threatening things, but we are challenged, so the standard of care is compromised to some extent because the things that we would normally offer to fully treat and manage patients, we are not able to do so at this time.
What about people who suffer from asthma? I've been hearing about people having to wait for inordinate long periods. What can you offer? Any counsel?
If you have any urgencies or emergencies, you should still present yourself to the emergency department, and we will try to offer the urgent care that we can at this time. But the level of care may be compromised due to the challenges that the hospital is having as it relates to the full capacity of supplies at this time.
Is there any word coming from the board? I know you would have met with them as to how soon or what they're doing to get a sense of normalcy back?
We can't speak on behalf of the Community Board. You'll have to take that with them.
However, the Accident and Emergency Department will continue to offer other urgent and emergency services. This has been a Nation News Extra.